Neoplasia. So again, the lung is a large vascular bed, which makes it a hotbed for metastatic activity. That makes sense. So differentiating a primary pulmonary neoplasia from a metastatic lesion can occasionally be challenging. So some hints that you might be dealing with a primary lung neoplasm. So that'd be like pulmonary carcinoma. There's often a single larger mass. So down here, that's this big white thing. It's basically facing this whole right cranial lobe. And then it may be surrounded by smaller masses. So in this lung, many small masses all over the lung. So if I covered up that right cranial lobe, you would have a hard time telling this from metastatic neoplasia, right? Because it's little dots everywhere. But you have a big primary lesion right here. And that points you to, okay, this is probably intrapulmonary metastasis. So this is probably a primary lung tumor. And then look at the rest of the animal. Does it have evidence of neoplasia elsewhere that could be a primary? Is there a tumor in the liver, in the pancreas, in the kidney? So metastatic, meaning not primary lung. So you found a primary tumor in a distant organ. Doesn't always happen. The primary for some of these can be very, very small. The pattern of lesions is going to be embolic. The lesions are all going to be roughly the same size. So this embolic showering, they're all kind of growing at the same rate. So they went to the lung, they got there, they're all kind of growing together, right? It's not continuous breaking off and seeding like it is with the embolic bacterial lesion, like coming off a heart valve, right? So the lesions are going to be pretty much roughly the same size. There's not going to be one big one and then a bunch of little smaller ones. So primary pulmonary neoplasia is mostly seen in cats and dogs and in some lab animals. It's pretty rare in other domestic species. Epithelial tumors are most common and most of them are malignant. There are a couple benign flavors, but we don't see them very often. Primary lung tumors often have malignant behavior in small animals. Confirmatory evidence, this one applies to cats only. But there's a thing called lung digit syndrome where cats with bronchoalveolar carcinoma specifically, they will metastasize to the digit. And occasionally this is the digit is the presenting complaint. So the person doesn't even know their animal has cancer. And they come in, oh, my animal has a weird, bleeding mass on its toe. You as a vet, you get a cat with a digital mass, you better be x-raying this bad boy because there's probably cancer in there. These do come through the biopsy service. We get the toes and we're like, hey, you should go look somewhere else. Again, you look like a wizard when you do that. All right, moving on to the pleura. So here it is. It's pretty simple. It's just a single layer of these mesothelial cells with their basement membrane that they made themselves. It's pretty flat. There's tight junctions in here. They do have microvilli. So these guys actually help to maintain the balance of fluid in your thoracic cavity. You have a little bit of fluid in there just for lubrication. They also participate in inflammation. So through their microvilli, they're constantly sampling fluid. They're looking for pathogens. They're producing cytokines. They are a little bit phagocytic, so they can actually take things up from the pleural space. However, it's pretty simple. It doesn't really have any defense mechanisms to speak of. There are some small lymphocyte aggregates, but really the pleura is just doesn't have a lot of immune capability. So responses to injury are also going to be pretty simple. It's going to be hypertrophy of this mesothelial layer, especially these mesothelial cells. They're going to get big and fat, and it's going to form these Ferrandi villus projections. So diseases of the pleura, space occupying effects are going to be a big deal. Also pain. Pleural disease is very, very painful. You have a lot of nerves in here. So pleuritis especially can cause animals to present with like reluctance to breathe, basically. So they can be not dyspneic, but they are able to breathe fine, but just the pain of like expanding their chest makes them like they like shallower breaths than they need to. Yeah.
You see more of that abdominal breathing rather than that chest inhale.
You could, yeah. That's a live animal question. These things I tell you about live animals, they're just things I've heard. All right, so space occupying effects, fluid in the chest cavity, air in the chest cavity, inflammation in the chest cavity, and then neoplasia. So causes of pleuritis, you can get extension of pneumonia. If it's severe enough, bronchopneumonia can spread, can involve the thoracic cavity. Can come in from the bloodstream, so septicemic disease can involve pleura. And then pretty commonly what we see in, especially I'd say horses and dogs, is some kind of penetrating injury either to the chest wall or to the diaphragm or occasionally to the esophagus, especially the thoracic esophagus. So dog swallows a stick, it goes from the esophagus into the thoracic cavity. Pleuritis. And then neoplasia, mesothelioma is really the only primary neoplasia of the pleural cavity, and it's pretty uncommon. In humans, it's associated with asbestos exposure. In animals, it is also associated with asbestos exposure. But animals don't get exposed to asbestos. Sometimes they do, I don't know. And then obviously metastatic neoplasia, go wherever it wants, do whatever it wants. Photos up here. So important point about pleural disease, especially if you have any kind of space occupying effect in the pleura. Look at these lungs. What do you want to call this lobe right here? Atelectasis. Here's normal lung back here. It's pink and still fluffy. This lung is collapsed and dark and shrunken. It doesn't have space to expand because we have a chylous effusion. Same with these guys. We've got a hemothorax. I think I spy with my little eye some potential metastatic hemangiosarc. See these little guys right here? One of which may have ruptured and led to this big hemothorax. So again, the lungs are shrunken down, they're pulled away from the chest cavity. They are atelectatic. Common consequence of pleural disease. This is what pleuritis looks like up close. So this is that mesothelial hyperplasia. The mesothelium are forming these little Ferrandi villus projections, and it looks almost like a shag carpet. This can be difficult to distinguish from mesothelioma. However, this is much more common than mesothelioma. Here's what mesothelioma looks like. So lumpy bumpy all over the pleural surface. Here it's actually firmly adhered to the diaphragm as well as the thoracic pleura. It's on the heart, pericardial sac, it's everywhere. So mesothelioma, a lot more firm and lumpy versus this hyperplasia is more soft and frondy, if that makes sense. So these are almost like a carcinoma. Very firm. Again, very uncommon. Okay, so confirmatory evidence of respiratory disease. Look at the rest of the animal. Look at the heart, especially the right side. Is there an enlarged right ventricle? That's called pulmonary. Do you have that in cardio? Are you in cardio yet? Yeah. Okay, so pulmonary is heart disease due to lung disease. So it's heart disease secondary to having to work really hard to pump blood through a jacked up lung. You end up with right-sided heart disease. Right-sided heart failure, enlarged liver, enlarged right ventricle. Aerophagia. So if you do radiographs on these animals and see a lot of gas in the stomach, they've been gulping air. So gas in the stomach means I've been working really hard to breathe and I'm actually like gulping air in. Jugular venous distension, so that can go along with right-sided heart disease and just you work really hard to pump blood through your lungs. Hypertrophy of your thoracic and abdominal muscles, so that's the heave line that we see in horses. they've been working hard to breathe chronically, and so they actually have hypertrophy of the muscles they're using to breathe. And then cyanosis, which is blue discoloration. So you need at least 5 grams per deciliter of reduced hemoglobin in your blood. That's the threshold before you can see cyanosis. That's an important number. You should know that 5. And that's it. That's it. When I first got here, it had more hair. But it was COVID hair, so it was ugly. All right. Questions?